All right. Okay, so before we came into the exam room, we were out there, I checked your height and your weight and your temperature and your blood pressure and your heart rate and your respirations and your oxygen saturations, and everything looked great. We also checked your visual acuity, where you stood 20 feet away and you looked at the Snellen chart, covered each eye and read the lines, and you had 20/20 vision in both eyes, so that was great, and that actually checked part of your cranial nerve 2 as well while we were doing that. So now that we're in the exam room, I'm going to just finish the rest of the exam on you. So first, I'm going to start, if you can bend your head down, I'm just palpating your scalp, looking at your hair distribution, making sure there's no lumps or masses. Do you have any tenderness when I touch there?
No.
No? Okay, you can look up at me. I'm going to palpate your frontal sinuses and your maxillary sinuses, and you tell me if you have any tenderness there.
No tenderness.
No? Okay, you can open your eyes. I'm going to look at your conjunctiva, your sclera, and your retina and your cornea, and your irises, and I'm just looking for any redness, swelling, discharge, which I don't see any, so that's great. Next, I'm going to palpate your temporomandibular joint, and so if you can open and close your mouth, great. I don't feel any clicking or rubbing, so that is great as well. And now I'm just palpating your auricles, make sure there's no tenderness or lumps or nodules there. You don't feel any tenderness, right?
No tenderness.
No tenderness. Perfect. All right, next I'm going to take a look into your ears. So I'm going to grab my otoscope and set that up. All right, so here on the left side, I'm just going to go in, and I'm looking, I can see your incus, your malleus, and your stapes, and also a pearly gray eardrum, no redness or inflammation, so everything looks good on that side.
Sweet. Trying to clean my ears real good.
Great. And now I'm going to look on your right side, and I'm looking for those same bony landmarks, which I see, and the pearly gray eardrum. So you do clean your ears well. That's great. Okay, next I'm going to look into your mouth. Oh, no, actually, sorry, let's do the nose first.
Okay.
So I'm just going to look up here, and I'm looking at your nasal turbinates. Your septum is midline. Everything looks clear, pink, and moist on that side. And clear, pink, and moist on this side as well. Great. Now I'm going to look into your mouth. I'm going to do some other tests while I'm in there, so let me just grab my tongue depressor. Okay, you can open your mouth for me. I'm just going to look at your tongue. It looks not swollen. There's no white patches. It's pink and moist. The roof of your mouth looks good. No patches or sores. Your teeth look good. Can you lift up your tongue for me? So I'm looking at the roof of your mouth. Everything looks good there, pink and moist. Stick out your tongue for me and move it left and right and up and down. Okay? All right, and then you're going to stick out your tongue, and I'm actually going to check your gag reflex and look at your tonsils, okay? Can you say off for me? All right, your tonsils are 1+, and there's your gag reflex. So that actually checked cranial nerves 9, 10, and 12 while we were doing that. So let me put this away. And your lips look moist and pink and not cyanotic and no sores there either, so that's great. Next I'm going to check for bone and air conduction and lateralization of your ears.
Okay.
So I'm going to bang this, and I'm going to put it on top of your head. You should be able to hear ringing in both ears.
Okay.
And just tell me if you don't, okay?
Sure.
Both sides?
Yes.
Okay, great. Next I'm going to bang it again. I'm going to put it behind your ear,
Okay.
and you tell me when you stop hearing the ringing. I'm going to flip it around, and then you tell me when you stop hearing that ringing. You should still hear ringing when I flip it around. Okay?
Understand.
You hear ringing?
Still here.
It stops.
And gone.
Can you still hear?
Still here.
Okay.
And it's gone.
All right, great. That side was normal. I'm going to do it on the other side.
Still here. And it's gone. Still going. It's gone.
All right, great. So you should be able to hear it longer in the front than in the back, so everything was normal with that. All right, next I'm going to look at your eyes. First I'm going to check for alignment, so just look straight at me.
Mhm.
Okay. All right, everything's good there. And now I'm going to look into your eyes. I'm going to look for your fundus, your disc margins, your red reflex, and your blood vessels in there. Just make sure everything's normal with that. So let me just make sure my ophthalmoscope is working. And alright, just open. Keep your eyes open for me. Alright, and there's the red reflex. And sharp disc margins, so that's good there. Around this side. And red reflex and sharp disc margins there. Okay, great. Alright, so the next part, I'm going to check the rest of your cranial nerves.
Okay.
So first we're going to start with cranial nerve 1, which is sense of smell. So I just want you to smell what's in here and tell me what's into this.
Peppermint and spearmint.
Yeah, peppermint. Great. All right. And so cranial nerves 2, 3, 4, and 6 all involve the eyes. So I'm just going to do all of those all at once. So first, if you can just look straight ahead at me and then just follow my finger wherever it goes. Okay, great. Now can you cover one of your eyes for me?
Okay.
And you're going to tell me, I'm checking your peripherals now, so look straight ahead at me, but tell me when you can see my hand. Just say yes when you can see my hand in your peripherals.
Okay. Here. See it. See it. Here.
Okay, let's do the other eye.
See. Still. Yeah. See. Still see.
See it. Okay, good. You can uncover your eyes. All right, next I'm going to check for your pupillary reflex. So let me grab this one. And just look straight at me. I'm making sure your pupils react to light. Yep. And they're both equal and reactive, so that's great. Next, I just want you to look at the otoscope.
Okay.
And now look at the wall.
Mhm.
And now look at the scope. Now look at the wall. Now look at the scope. Okay, that just checks for accommodation. All right, so next is cranial nerve 5.
Okay.
So I'm just going to palpate your muscles again. Can you clench your teeth for me? All right, great. And I'm also going to check the sensation in your cheeks.
Okay.
So let's do this. Say yes when you can feel me. When you can feel anything. Okay.
Yes. 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 Yes.
Kind of hard with your beard.
Yes. 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 Yes.
All right, great. Now cranial nerve 7 checks kind of your facial movements and muscles. So can you close your eyes real tight for me? Now open them real wide. Now clench your teeth for me and show me all of your teeth. And now smile and frown. Can you smile for me and frown? And now puff out your cheeks like this. Nope, puff them out. Yep, like that. Okay, perfect. All right. Now cranial number 8 is the whisper test. So I'm just going to whisper something in both of your ears, and you tell me what I said.
Okay. Apple. Ball.
All right, great. And then cranial number 9, 10, and 12, we already checked with your gag reflex and all that.
Okay.
So the last one is 11, and so it's just your sternocleidomastoid and your trapezius muscles. So can you push up on my hands? Great, perfect. So everything's good there. All right, so now I'm going to move down to your neck. I'm just kind of looking for any abnormal lumps, masses. Do you feel any tenderness when I'm palpating?
No.
No. Okay, great. I'm going to palpate your lymph nodes now, okay? So I've got your post-auricular lymph nodes, your pre-auricular lymph nodes, your parotid, your retropharyngeal, your submandibular, your submental, your posterior cervical chain, your anterior cervical chain, and your supraclavicular. And I don't feel any swollen lymph nodes, so that part is great. Your trachea looks midline, everything's good there, and I'm going to palpate your carotid arteries. Alright, they're 2 plus, so I'm regular there. Now I'm just gonna listen to them with the bell on my stethoscope. See if I feel any thrills, or hear any thrills. Bruise, sorry. That's what I meant to say. And I don't hear any bruise there. Okay,
Alright.
great. So now if I can have you sit down on this chair right here, facing that way, I'm gonna check your thyroid gland. You feel like you got enough spit in your mouth right now to swallow something?
Got enough.
Okay, I'm just feeling it where your thyroid is. Okay, can you swallow for me? All right, and it moved up equally on both sides. I'm just gonna push it to the left to feel for any nodules, which I don't feel. Push it to the right, feel for any nodules, which I don't feel. All right, it's great, everything's normal there.
Alright.
I'm just gonna look at your back, see, feel for any tenderness,
Okay.
abnormal masses, lumps. Do you feel any tenderness when I touch you?
No tenderness.
No tenderness, great. And now I'm just gonna look for equality of your respiration. So can you take a deep breath for me? And exhale. All right, and they're equal on both sides, so that's great. Next, I'm gonna check for tactile fremitus. So I'm gonna ask you to say 99 whenever you feel my hand on your back, okay?
Okay.
So say 99 for me.
99, 99, 99, 99, 99, 99.
Great, okay. Now I'm going to percuss your lungs. So just I'm gonna use my little hammer over here. All right, and all the sounds are resonant. But now I'm going to check for a diaphragmatic excursion. So what I need you to do is take a deep breath for me and hold it. All right. And here. Okay, now exhale, take a couple deep breaths. Exhale and take normal breaths. All right, and now exhale all the way and hold it. Right, and between 3 and 5 centimeters, 3 and 4 centimeters about, which is normal, so that's good there. All right, next I'm going to, you can breathe regularly again.
Okay.
Gotta remember to tell you to breathe. Next I'm gonna listen to your lungs.
Okay.
Can you give me a couple deep breaths? Two more. Last one. All right, great. They're all clear. Last thing while you're sitting down there, I'm going to check for CVA tenderness just to make sure that your kidneys aren't acutely inflamed. Do you feel any tenderness or pain when I knock you on the side here?
No.
All right, perfect. You can come sit back up on the exam table, please. And just to mention, the other cranial nerve 5, 7, 10, and 12 is your
Okay.
voice and your articulation, making sure you're not slurring your speech or garbled or anything. Everything's normal with that. So just wanted to let you know that I checked that as well. All right, so next we're going to, I'm going to just look at your chest.
Mm-hmm.
Palpate here for any tenderness. Do you have any tenderness?
No tenderness.
No tenderness. All right, I'm going to do the tactile fremitus again so you can say 99 6 times again.
Okay. 99, 99, 99, 99, 99, 99.
Okay, great. And I'm going to percuss again just to make sure all the areas are resonant. Okay, everything was great there. All right, next I'm going to listen to your lungs from the front side. Give me a couple deep breaths again. Two more. Okay, great. You can breathe regular. Next, I'm going to listen to your heart sounds. So let me just move this pen here so that it can get in the way of the stethoscope. All right, so I'm listening to your aortic sound, your pulmonic, your pulmonic number 2, your tricuspid, and your mitral. Great. I'm going to listen with the bell of my stethoscope as well. Three, same sounds, tricuspid, and mitral. All right, great. I'm going to palpate your apical pulse real quick. Feels any thrills, and I do not. All right, so that's great. You can actually lay down for me if you don't mind. Maybe, just so the camera can see, scoot this way, down this way, just a little bit more. Okay, I'll bring this up for you. You comfortable?
Yeah, I'm good.
You good? Okay. All right, I'm gonna listen to your heart sounds again while you're laying down. And also I'm noticing while you're laying down in the recumbent position, I don't see any jugular venous distension, bounding of your jugular vein, which is good. And that's normal as well. And before I listen to you again, I'm gonna palpate your pulses. So I got your brachial, your radial, your brachial, and your radial, and your femoral. All right, everything's great there. 2+. I'm going to listen to your heart sounds again.
Okay.
Got your aortic, your pulmonic number 2, tricuspid, and mitral. And again with my bell. 1, 2, 3, 4, 5. All right. Everything sounded equal. Everything sounded great. No breweries or anything like that. So next I'm going to move to your abdomen. Is it okay if I lift up your shirt for this?
Mm-hmm. All the fat out.
All right. First I'm just going to check for your abdominal reflex and your peristaltic movement. So.
Okay.
All right. And they're present there, so that's great. Next I'm going to listen to your belly sounds. In all 4 quadrants. You got normal belly sounds, so that's great. Next, I'm going to listen for any bruits in your aorta, your renal arteries, your iliac, and your femoral. And I did not hear any, so that's great there. All right, next I'm going to percuss your abdomen just to make sure there's any masses before obvious masses before I start
Okay.
palpating your abdomen. So. Great, I didn't hear any dullness there. So now I'm going to measure your liver span. So got my tape. Sorry.
No, you good.
Just in case it's up higher than I expect. Right. And they're about 5.5 centimeters, so and the liver is your midclavicular line, so it does not seem to be enlarged, so that's great. All right, next I'm going to palpate. I'm going to first feel your vertical and horizontal inguinal nodes just to make sure that those are not swollen.
Okay.
And I don't feel those. All right. Next I'm going to do a light palpation. You just tell me if you feel any tenderness, okay?
No senders. No tenderness.
No tenderness. Okay, I'm gonna go a little deeper just to see if I can feel any masses or any of your organs. Okay, and I'm going to try and palpate for your liver, which we found was down here. I can just feel the tip of it. Does not feel enlarged, so that's great. I'm going to see if I can feel your spleen, which I shouldn't. And I don't feel anything there. I'm going to feel for your kidneys, which I should also not be able to feel. And I don't. This side as well. And I don't feel your kidneys there. Okay, you can sit on the side of the exam table again for me, right over here. All right, next I'm going to start with your shoulders and go down your arms. So I'm going to palpate, see if you feel any tenderness. Looks like you got good muscle mass, no tenderness,
No
right?
tenderness.
And I'm feeling to see if your epitrochlear nodes are inflamed or swollen, and I don't feel those, so that's good. All right, moving down to your hand, I'm going to check your capillary refill, which is less than 3 seconds, and that's normal. And I'm just feeling your knuckles to see if there's any nodules there, and there's not. Can you squeeze both of my hands? I'm just checking for equal grips. All right, perfect. Next, I'm gonna, if you can close your eyes, I'm gonna put something in your hand, and I want you to feel around and tell me what it is.
Pin.
Yep, that checks for stereognosis. You can open your eyes.
Okay.
Right, next I'm going to check for your coordination real quick. So if you can touch your nose and then go out like this really fast. Great, everything's normal there. And then just real quick, turn over fast, slow, fast, slow, fast, slow. Okay, perfect. All right, next I'm going to check the sensation on your arms. So you say yes when you can feel something again, okay?
Yes. 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 Yes.
Now sharp.
Yes. 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 Yes.
Perfect. And now last sensation is vibration.
Yes. 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 Yes.
All right, perfect. Next, I'm going to check your deep tendon reflexes. You can open your eyes so you can see what I'm prompting you to do. If you can bend your arm up like this, like you're kind of being a robot, I'm going to check your triceps first. Yep, there it was. Come down here. I'm going to check. No, sorry, just that arm. You can relax this arm now. I'm going to check bicep. Okay, and your brachial ulnar. You can just relax this arm on me. Okay, and let's do this side. Okay, and down here. Okay, down here. Okay, great. Now I'm going to do your patellar. That again. Okay, little bump there. Bump there. I'm going to check your Achilles. Little flex there. Little flex there. And last is the Babinski.
I feel.
And your foot flexed the right way, so that's great. All right, now that I'm down on your legs, I'm just going to pull your pant legs up just a little bit. I'm looking at your hair distribution in your skin. Make sure there's no sores, there's no bulging veins or varicose veins, no swelling, and it doesn't look like it, so that's good.
You got good girl legs.
Good what leg?
Good girl
Good
legs.
girl leg. Yeah, you don't have too much hair, that's good. Next, I'm going to check for your pulses. So I'm going to feel your popliteal pulse, your posterior tibial pulse, your dorsalis pedis pulse. And I'm also going to check your capillary refill down here, which is also less than 3 seconds, so that's good. Let me check the pulses on this side. Posterior tib, dorsalis pedis. All right, good job. Next, we're going to check the range of motion and strength in your ankles.
Okay.
So if you can plantar flex for me, dorsiflex for me, lift your foot up and point it down. And now do inversion and eversion. You can do it on this, up, down, in, out. And now you're gonna push, now I'm gonna check the strength. So push up on my hands, hold it, push down on my hands, pull in, and out. Alright, perfect. Alright, the rest of it is going to be done standing up.
Okay.
So, I'm trying to think for the camera angle. This is probably best, yeah. Okay, so next we're gonna do your knees. Actually, maybe turn towards the camera.
Okay.
That way you don't hit the tray when you bend your knees. So can you flex your knee for me and hyperextend it? Great, and do the other one. Flex, hyperextend. Okay, great. Now we're gonna do your hips.
Okay.
And so I want you to, we're gonna abduct first, so
Okay.
out, and then over here, adduct. Yep, and now forward and backwards. I'm losing my balance, test your balance too, huh? And then rotate in and out, that other leg, right leg, rotate, yep. And out. Okay, now do the same thing with that one. Out, and in, forward, back, and then rotate, in and out. Okay, your hips are great. Your hips are great. Now we're gonna do your spine, so
Okay.
if you can rotate for me around, yep. And then you're gonna lateral bend, left and right. And you're gonna hyperextend back, right? And now I'm gonna have you bend all the way forward, and I'm gonna check your spine for scoliosis at the same time. And it seems straight, your scoliosis screen is clear. Okay, you can face me now, go back towards the table, but you're still gonna stand up.
Mhm.
All right, next we're gonna do your hands. Can you flex your hands for me? Open them. Abduct your fingers, spread them all the way out. Okay, great. Now your wrists, we're gonna flex, extend. We're gonna ulnar and radial deviation. Great. Okay, now we're gonna do your elbows. So flex, hyperextend, and now pull against me when you do that. Or can you flex upwards and now push? Upwards, push. Okay, great. Now we're gonna do your shoulders.
Okay.
So we're gonna abduct first, adduct. You're gonna raise your hands forward and backwards, reach behind your back, and now you give yourself a big hug because we're almost done. Great. Now I'm gonna check the range of motion in your neck. So
Okay.
if you can turn left and right, tuck your chin down to your chest, go backwards, and touch your ears to your shoulders. Perfect. Everything looks normal there. All right, the last few bits are your balance. So I'm
Okay.
going to do the Romberg test, and I just want you to stand with your feet together and put your arms out like this and close your eyes. And I'm just looking for any swaying, which I don't see. So you're great there. All right, you can open your eyes and stand normal. Next thing, I want you to walk from here to there, with heel to toe. Put your heel in front of your.
All right. Well, I be you out then.
Yeah. And now when you go back, you can turn around, go back and walk on your tiptoes. All right, perfect. And as you walked into the exam room, I noticed that your gait was steady there, so we checked that and everything checked out. So high five, you did a good job.
Yeah.
You passed, A+.
What's physical then I have? The military exam's not as thorough.
The military exam's not that thorough, huh? Interesting. All right, thanks so much.